Hey guys, welcome to another video. Today we'll be talking about hernia. We will be covering the symptoms of hernia, risk factors, and prevention tips. Let's get started. So, a hernia is a medical condition that occurs when an internal body part, such as an organ, protrudes through a weakness or opening in the surrounding muscle or tissue. Hernias can occur in various parts of the body, including the abdomen, groin, diaphragm, and upper thigh. Hernias occur when the muscles and tissues that surround and support an internal organ weaken or tear. This can happen due to a variety of reasons, such as aging, injury, surgery, or physical stress. When the muscles and tissues weaken, they can no longer hold the organs in place, and the organs can push through the weakened area, causing a bulge or lump. Common types of hernias include inguinal hernia, which occurs in the groin area, umbilical hernia, which occurs around the belly button, and hiatal hernia, which occurs in the diaphragm. Other types of hernias include incisional hernia, which occurs at the site of a previous surgical incision, and femoral hernia, which occurs in the upper thigh area. Symptoms of hernia can include a bulge or lump in the affected area, pain or discomfort, weakness or pressure in the surrounding muscles, and difficulty lifting or pushing heavy objects. If left untreated, hernias can lead to serious complications such as strangulation or obstruction of the affected organ. Treatment for hernia typically involves surgery to repair the weakened muscle or tissue and return to the protruding organ to its proper position. In some cases, medication or lifestyle changes may also be recommended to manage hernia symptoms and prevent future occurrences. Now coming to the symptoms. The symptoms of hernia can vary depending on the type and location of the hernia. However, some common symptoms of hernia include bulging or protrusion. A visible bulge or lump may be present in the affected area, especially when standing or straining. Second is pain or discomfort. Pain or discomfort may be felt in the affected area, especially when bending over, coughing, or lifting heavy objects. Third is weakness or pressure. Weakness or pressure in the surrounding muscles may also be felt, especially in the groin or abdominal area. Fourth is difficulty lifting. Difficulty in lifting or pushing heavy weights may also be experienced, especially if the hernia is in the abdominal or groin area. Fifth is heartburn or acid reflux. Hiatal hernias can cause symptoms of heartburn or acid reflux as the stomach pushes upward into the chest cavity. Sixth is nausea and vomiting. In some cases, hernias can cause nausea and vomiting, especially if they become strangulated or obstructed. It is important to note that not all hernias cause symptoms, and some hernias can only be discovered during a routine checkup. If you experience any of these symptoms, it is important to seek medical attention to diagnose and treat the hernia, as untreated hernias can lead to serious complications. There are several risk factors that can increase the chances of developing a hernia. First is age. Hernias are more common in older adults as the muscles and tissues that support the organs weaken with age. Second is genetics. Some people may be more genetically predisposed to developing hernias, especially if their family members have a history of hernias. Third is obesity. Being overweight or obese can increase the pressure on the muscles and tissues in the abdomen, making them more prone to weakening and tearing. Four is pregnancy. The weight and pressure of the growing fetus can also put extra strain on the abdominal muscles and tissues, increasing the risk of hernias in pregnant women. Fifth is chronic cough or straining. Chronic coughing or straining due to conditions such as chronic obstructive pulmonary disease or constipation can also increase the risk of hernias. Sixth is previous abdominal surgery. Previous abdominal surgery can weaken the muscles and tissues in the area, making them more prone to hernias. Next is smoking. Smoking can also weaken the muscles and tissues in the body, making them more prone to hernias. It is important to note that while these risk factors can increase the chances of developing hernia, hernias can still occur in people without any known risk factors. If you are at a risk of hernia or experience symptoms of hernia, it is important to speak with your healthcare provider for further evaluation and proper treatment. While hernias can occur for a variety of reasons, there are some steps you can take to reduce your risk of developing one. First of all, maintaining a healthy weight. Being overweight or obese can increase your risks of developing a hernia, especially in the abdominal area. Maintaining a healthy weight through a balanced diet and regular exercise can help reduce your risk. Second is practice proper lifting techniques. Lifting heavy objects improperly can put a strain on your muscles and increase your risk of developing a hernia. To prevent this, use proper lifting techniques such as bending your knees and lifting with your legs instead of your back. Avoid straining during bowel movements. Straining during bowel movements can put pressure on your abdominal muscles and increase your risk of developing hernia. To prevent this, eat a high fiber diet, drink plenty of water, and try to establish regular bowel habits. Fourth is quit smoking. Smoking can weaken your muscles and increase your risk of developing hernia. Quitting smoking can help you improve your overall health and reduce your risk of developing hernia. Lastly, exercising regularly. Regular exercise can help strengthen your muscles and reduce your risk of developing hernia. Focus on exercises that strengthen your core muscles, such as sit ups and planks. While these tips can help reduce your risk of developing hernia, it is important to remember that some hernias can still occur despite taking preventative measures. If you experience symptoms of a hernia such as pain or a visible bulge, it is recommended to seek medical attention for proper diagnosis and treatment.